Good afternoon, everyone. We're going to wait just a minute so we can get all the people that are waiting in the lobby in. All right, the number of people entering seems to have slowed down, so we will get started. Good afternoon and welcome, everyone. I know we've got quite a few registrants for this webinar, and your time is valuable, so we're going to get this show started. I'm Michelle Colby, and I'm the National Program Leader for Animal Biosecurity here at NIFA. I'm a veterinary epidemiologist and currently the lead national program leader for NIFA's veterinary service programs, which includes the Veterinary Medicine Loan Repayment Program and the Veterinary Services Grant Program. I'm going to ask Jennifer to move to the next slide, and we'll go over a few logistics, and then I'll ask the rest of the team to introduce themselves. So before the rest of the team introduces themselves, a few logistical reminders. This webinar is being recorded. All microphones should be muted automatically, but if you unmute to ask a question, please be sure to mute your microphone when you're done. Danielle, we're using the chat, right?
We'll use the Q&A and the chat if needed.
Okay, so rather than the chat box, please make sure you utilize the question and answer function. You can type any questions you have in there, and we will do our best to respond to them before the end of the webinar, either in writing or verbally. Jennifer and Danielle will be monitoring that. Finally, once we're finished, the slides and recording of this webinar will be posted to the same page you used to register. You'll also get an email including the link to this, but we'll put the link on the slide, and you can put this in the chat. Processing might take a day or two, so please give us until the end of the week for this to get posted. I'm going to ask Jennifer to move on to the next slide and the rest of the team to introduce themselves, and we'll start with Danielle Farley.
Hey there, everyone. Danielle Farley, Program Specialist here at NIFA. I work with the veterinary programs as well as several other programs, and I've been working for NIFA for about 5 years now. Jennifer?
Hi, Jennifer Stratman, based out of Denver, Colorado, and I work under the veterinary programs as well, and a few others scattered around NIFA. I've been with NIFA for, I think, 2.5 years or so. So nice to be here and welcome everybody.
Thanks, Jennifer. Is Meredith on board?
Meredith is not. Meredith is our program assistant, and she has also been at NIFA for about 5 years now, working with the veterinary programs. Yep.
Thanks, Danielle. We'll move to the next slide. So we've got about 45 minutes of material to cover, which should leave us about 15 minutes to respond to questions. Please, again, feel free to post your questions in the Q&A box so we can be, as soon as you think of them, so we can be prepared to start responding to questions right away at the end. We've also built in some wiggle room in our schedule so we can stay on a bit longer if needed to ensure that all questions are answered. So the next thing we're going to do is start with a very brief overview of NIFA, the National Institute of Food and Agriculture. So the National Institute of Food and Agriculture is a science funding agency of USDA. We invest in and support initiatives like the VMLRP and the Veterinary Services Grant Program that ensure long-term viability of U.S. agriculture. In addition to funding, NIFA provides scientific and strategic leadership for programs that directly benefit U.S. farmers, ranchers, and producers. Next slide. To that end, NIFA has a very broad portfolio of programs that cover many topics, including animal and plant health and production, food science, security, and safety, and veterinarians play a key role in many of these program areas. If we go to the next slide, I'm going to transition to a high-level overview of veterinary services grant programs with additional details to follow. So the purpose of both the VSGP and the VMLRP are to ensure that the U.S. has sufficient food animal veterinarians in all areas where they are needed. To accomplish this, the Veterinary Services Grant Program offers 2 program areas. The Rural Practice Enhancement program area is directed towards private veterinary clinics providing services in designated rural veterinary shortage areas and provides support for operating expenses and equipment purchases. We'll get into more details on this later, but I wanted to point out that an important difference for those of you who are familiar with the VMLRP. The RPE awards are provided to the clinic, not the individual practitioner. So throughout this presentation, when we say applicant, context of rural practice enhancement, we're referring to the institution, clinic, or business, which is applying to the award, not the individual. The Education, Extension, and Training, or EET program area is for accredited schools and organizations to support education and extension activities that support enhanced skills in food animal veterinary medicine or practice to veterinarians, veterinary students, veterinary technicians, and veterinary technician students. Please note that this list does not include undergraduates or pre-veterinary students at this time. They can be included in your efforts, but the primary focus of your application should be on one of the listed groups. Veterinary shortage areas are utilized by both VMLRP and VSGP Rural Practice Enhancement programs. Shortages are nominated each year by state animal health officials or federal chief veterinary officers and designated by NIFA. Rural Practice Enhancement applicants apply to serve designated veterinary shortage areas. If there are two that include the area in which you practice, we advise that you review both and select the one that you feel can provide the strongest case for regarding your ability to serve the shortage fully. You can view which shortage areas are available for applications on the Veterinary Services Shortage Situation map, which is available at the link provided on the slide, and I believe Jennifer just put it in the chat as well. Shortage situations for FY26 were posted on January 5th, 2026, and these shortage areas are used by the peer review panel to evaluate each RPE applicant's ability to address the shortage area. This is something that you should definitely consider when preparing your narrative. Next slide. So there are 3 types of veterinary shortage situations, and only one shortage type can be designated per nomination. Shortage types are classified based on % full-time equivalent and practice type. The FTE is the number of working hours that represents one full-time equivalent employee during a fixed time, and that for us equates to a 40-hour work week, though we recognize that many of you work more than 40 hours a week. So the type 1 shortage area requires a minimum of 80% full-time equivalent or 32 hours per week commitment. These nominations are intended for shortage situations where the submitting official believes the veterinarian can operate profitably by committing 80 to 100% of their time to food animal medicine activities based on the client base and other socioeconomic factors impacting viability of veterinary practices in the area. Please note that for RPE, this shortage type must be in a rural area to be eligible. And you can find more information about how to demonstrate this in your application in the NOFO. A type 2 shortage area must also satisfy the definition of rural area. A minimum of 30% full-time equivalent commitment or 12 hours per week in a rural shortage situation recognizes that some remote or economically depressed rural areas do need food animal veterinary services, but may be unable to support a practitioner predominantly serving in the food animal sector. So this provides an opportunity to balance the companion animal and the food animal work as well. These nominations are intended for shortage situations where the submitting official believes the veterinarian can operate profitably, committing at least 30% of their time to food animal medicine activities based on the client base and other socioeconomic factors. Type 3 is a broad category comprised of many public service veterinary training and employment areas. I'm not going to go into detail on that here because type 3 shortage areas are not eligible for RPE. And if we go to the next slide. To be eligible for the Rural Practice Enhancement Program area, you must be a for-profit or not-for-profit entity that provides mixed food animal veterinary services to a current VMLRP shortage area. The one exception to this is if a clinic or hospital currently employs an active VMLRP awardee. The VMLRP awardee must have a current service agreement with NIFA at the time of application, and in that case, the clinic can apply for the awardee's shortage area. If you do this, you must reference that specific shortage area. If you do have an active awardee and are also providing service to a different shortage area that is open, you need to consider carefully which one you can best describe your ability to address in your VSGP narrative. The one you apply to should be the one you can best provide service to. If you do apply to a shortage area for which you have an active VMLRP awardee, you must agree to maintain that individual's employment for the period of the award. I'm going to reemphasize here that rural practice enhancement awards are made to clinics, not individuals. If you are a solo practitioner, It is your business that must apply, not you as an individual. Please also be mindful that if you're applying to a type 1 shortage, it must be located in a rural area. We provided a link here on this slide, which is also included in the NOFO, that you can use to verify eligibility. Put your business address in the online tool and it will generate a map that tells you whether or not it's in a rural area. You must include this map with your application. Next slide. So if you do receive an award, what can you use the funds for? You may use it to equip a clinic. This could be in clinic or mobile equipment to allow you to expand your practice to additional species, offer additional services needed in the shortage area, expand your ability to provide haul-in services within your clinic. You may also include reasonable operating and overhead costs. Note that these must not exceed 50% of your award. This includes things like salary and benefits for current and new staff that would support the provision of food animal services in the shortage, rent, fuel, utilities, equipment maintenance contracts, etc. Within the bounds of the parameters I just discussed, you may also use both the equipment purchase and overhead costs to establish or support mobile practices or haul-in veterinary facilities. So you can purchase the equipment for these things, but you cannot fund construction, and I'll get to that on a separate slide. You can also include funding to support exposure of students in grades 11 and 12 to opportunities in food and fiber, animal medicine, and herd health management. Next slide. So what are some of the limitations or some things you need to consider when preparing your RPE application? RPE applicants may, again, only apply to serve one designated veterinary shortage area each year. So if there are two that you're looking at, consider carefully which one you can provide the strongest case for in your narrative. We will only make one award per shortage area each year, and only one award is allowed per applicant and clinic. If the clinic is a prior recipient of an RPE award, they can apply for another award. Pardon me, this is a lot of talking. They can apply for another award after their previous award ends. So if you have an award currently and it doesn't end until July of 2026, you are not eligible to apply this year. If the current award ends before April, the clinic can apply for another award, but they must apply to a current shortage area, not the one they applied to previously, unless they have an active VMLRP recipient on staff, as I discussed in a previous slide. Awardees are expected to cover requested services described in the shortage nomination, regardless of the number of hours per week. So please keep the shortage description handy and consult it when preparing your narrative. All right, next slide. For education, extension, and training eligibility, this is fairly broad, but to serve as the project director, you must be employed by one of the types of institutions listed on this slide. If an institution not on this list has a relevant proposal, they can submit and receive funding in partnership with one of the eligible institutions on this list, but the eligible institution must serve as the lead. So if you have a good idea, you're not listed on this slide, you need to find someone that it works in an institution that is listed on this slide to partner with. They can serve as the lead PD, but you are eligible to receive funding under that type of an award. If we go to the next slide, EET proposals should emphasize educational content that enhances learning in one or more of the topics on this slide. Mechanisms for conveying this content may include traditional or non-traditional learning opportunities, non-degree educational training programs, courses associated with existing degree programs, and continuing education. We encourage EET applicants to collaborate and be creative and innovative in their approaches to this NOFO. We go to the next slide. In FY26, the EET focus will be placed on programs that direct activities towards one or more of the groups listed on this slide. A reminder that this does not include undergraduate pre-veterinary students. This does not mean they cannot be included in your proposal. It does mean that they should not be the primary focus. We are aware that this list inadvertently does not include actual graduate veterinarians. We are working to rectify that. In the meantime, proposals related to veterinarians who have already graduated are eligible to apply. They're just not currently listed in the priority group. But as I mentioned, we are working on rectifying that. EET funds can be used to cover Support expenses of the groups I just mentioned on the last slide to attend training programs related to food safety or food animal medicine. Update course materials for in-person or remote learning in accredited veterinary education programs, including the recruitment and retention of faculty to support these courses. They can also be used to support training of veterinary residents, interns, externships. On this element and all others, be mindful that the purpose of EET activities is to substantially relieve veterinary shortage situations and/or support practices engaged in food animal, clinical, and veterinary public health activities. So consider the impact of what you're proposing in these areas when writing your narrative. For example, a program that might train 10 interns and residents versus a program that might train just 1 or 2. They can also be used to provide continuing education and extension outreach efforts. This includes virtual and other forms of distance-based education. This award can also support activities with high school juniors and seniors to expose them to career opportunities in food animal medicine. Your proposal can include any of these types of activities, but there is no requirement that you have to include all of these activities in your proposal. Jennifer, can we move 2 slides forward, I think? 1 more. Thank you. As I mentioned on an earlier slide, mechanisms for conveying educational content in your award may include traditional or non-traditional learning opportunities, non-degree educational training programs, courses associated with degree programs, existing degree programs, and continuing education. Please note that applications to support graduate programs with a primary focus on research will generally not be accepted, and applicants should consider other NIFA program areas such as those included in the AFRI Educational and Workforce Development Notice of Funding Opportunity. Next slide. All right, as I promised earlier, so both RPE and EET funds cannot be used to construct or renovate practices or facilities, to acquire, expand, remodel, or alter an existing facility. As I said earlier, if the practice is going to remodel a facility and you wish to use your VSGP award to purchase equipment, fencing, etc., to go in that facility, that is acceptable, but you can't use the VSGP funds for the construction or renovation. They cannot be used to conduct research. For research-related proposals, we suggest the AFRI, or Agriculture and Food Research Initiative Notice of Funding Opportunities. There are 3, which can be found at the link on this page. Strengthening agricultural systems, foundation on applied systems, and the one I mentioned earlier, the Education and Workforce Development Notice of Funding Opportunities. You may also not establish new veterinary medicine or veterinary technician programs or curriculums. You can expand them, but not establish them. If we move to the next slide, you're ahead of me, Jennifer. So we accept 2 types of applications: new or not previously submitted to the VSGP, and resubmitted. So proposals that were previously submitted to the program but not funded. Danielle will provide more details on any unique requirements for each of these later in the presentation. Next slide. Neither RPE or EET will consider duplicate submissions. If you submit early and want to make a change, please email us at vsgp@usda.gov and let us know the original grant tracking number and the new grant tracking number and confirm which one you would like us to review. As we've covered before, multiple submissions are not allowed under RPE. RPE applicants may only apply to serve 1 designated veterinary shortage area each year. So again, if there are 2 that include the area in which you practice, we advise you review both and select the one you feel you can provide the strongest case for in your narrative. As a reminder for RPE, a clinic cannot apply for a new VSGP RPE award until any previous awards have ended. Multiple submissions are allowed by different departments of eligible institutions under EET, but we will make only 1 award per institution per year. For EET, an institution may have multiple awards that were granted in different years to different departments and different project directors. Next slide. So cost share, matching, and indirect costs, no matching is required. Matching resources will not be considered or factored into the review process as an evaluation criteria. Indirect costs are handled differently between the 2 program areas. Indirect costs for EET should not exceed 30% of the total funds awarded. And for RPE, indirect costs are not allowed. You are allowed to request funds for overhead costs, and this budget item should not exceed 50% of your total award request. Now I'm going to turn it over to Danielle to review some of the additional details of the application and the associated documents.
All right, thank you, Michelle. Now let's discuss the application details. The VSGP Notice of Funding Opportunity, or NOFO, as we like to call it, is a document that has all the details and requirements for submitting a VSGP application. It is available on the Funding Opportunity webpage, which is also where this recording and a PDF of the slides will be published sometime either this week or early next week. You can find the link provided on this slide, and Jennifer will also share the VSGP NOFO link in the chat. Deadlines are clearly outlined on the Funding Opportunity webpage and the front page of the VSGP NOFO. The VSGP deadline is April 16th at 5 p.m. Eastern Standard Time. To apply, you will need a unique entity ID number or UEI number, which you can obtain through sam.gov. Please note that it can take up to 4 to 6 weeks to obtain this number, so please do not delay in initiating the process. There is no fee to obtain your UEI number. Most EET applicants will already have a UEI number, but most RPE applicants will need to apply for this. The sooner you do this, the better. As NIFA staff, we do not have the ability to offer technical assistance. With your UEI number, you will need to contact sam.gov for technical assistance. If the application deadline is approaching and you have not received your UEI number, please email us at vsgp@usda.gov. The last thing I want to say about UEI number is that you do not need to wait to prepare the application materials we are about to discuss shortly. You can work on your application while you are waiting on your UEI number. Completed applications are submitted through grants.gov. There is no fee to submit an application, and we've provided the contact information for grants.gov support if you encounter challenges when submitting your application. Again, NIFA staff, we do not provide technical assistance with grants.gov, so you will need to contact their help desk if you're having issues. This information is also included in the VSGP NOFO. Please note that everything submitted through grants.gov must be in a PDF. If a document is in any other format, it will not go through our system and will result in an automatic decline. Don't let this happen to you. Submit in PDF only. Lastly, submitting a grant through grants.gov is free. If you are being asked for payment, you are likely not on an official government site. Additionally, there is no fee for a UEI number and no fee, again, to submit your grant. If you're being asked to pay anything for a UEI number or to submit your grant on grants.gov, it's likely a scam and is not an official government website. Okay, let's discuss the application details. So the total amount of anticipated funding available for awards under this program will be listed on the front page of the VSGP NOFO. The funding ranges for RPE is between $75,000 and $200,000, and EET awards are between $75,000 and $300,000. When completing your application, you will be asked for a few identifiers to make sure your proposal is submitted to the appropriate program. The CDFA, which stands for Catalog of Federal Domestic Assistance Number for VSGP, is 10.336 for both EET and RPE for both programs. And the program code is VSGPR for RPE and VSGPE for EET. This information is also included in the VSGP NOFO. Again, you'll be asked to input these codes and these numbers when you apply through grants.gov. The duration of both programs is 36 months. And we suggest that you include a start date of August 2026 in your application and when you're preparing your timelines for your grants. The duration for both RPE and EET awards, again, 36 months or 3 years. That is your plan to accomplish all of the goals of the grant. And that's when your grant will end unless you request a no-cost extension. We, again, suggesting you use a mid-August start date when completing your grant application. If you use another start date, that is okay. But as you prepare a timeline, it's helpful for an anticipated start date of August 2026. Next slide, please. All right, now let's discuss the key forms and documents. A complete application is composed of many distinct documents which are listed here. I will review some of these documents in the following slides, and you can find additional details in the VSGP NOFO. So in grants.gov, there are mandatory forms. That includes the SF-424, budget, key person, profile, performance site. For EET, we also will be requesting current and pending and a conflict of interest for co-PDs and project directors. For all applications, you're required to include a project summary or abstract, a project narrative, veterinary shortage area information. This is for RPE only. Clinic service area map, again for RPE only. Rural development map for type 1 shortage area applications, RPE only. A budget justification, biosketch, which is also considered a resume of the project director and co-project directors, data management plan, and other documents that may be included are indicated in the NOFO, so such as resubmitted applications, response to previous review, and for EET only, if you're collaborating with outside organizations, you'll be required to submit commitment letters. As a reminder, any document you upload to grants.gov must be in PDF. Next slide, please. Okay, let's discuss the RPE project narrative. For the RPE project narrative, there is a table in the NOFO which includes suggestions for usage of page limit for the narrative. I will emphasize a few important reminders here. Again, we can't say this enough. Attachments must be in PDF format. Written text may be up to 7 pages. This should be 1.5 spaced with 1-inch margins and 12-point font. Tables may be single spaced and 11-point font, and you are allowed 2 additional pages beyond the 7 figures or the 7 pages for figures and tables. These pages should also have 1-inch margins. Please note that these items are strictly enforced, and applications not meeting the requirements will be returned without review. Within the narrative, you should provide an introduction or background which describes the nature of the shortage area you are planning to address, your objectives and approach for addressing this shortage, the anticipated results, and your timeline for the actions you propose. We suggest reading the NOFO for further guidance on what to include in your project narrative. We highly recommend proofreading the project narrative for grammar and spelling. If possible, it is always helpful to have a trusted source review your professional narrative before submitting. DVM, alumni associations, professional organizations, or professional development departments at your alma mater may provide this service for free. Next slide, please. All right, let's discuss the RPE maps. A map outlining the proposed clinic service area is required for all RPE applicants. Maps can be hand-drawn or digital, and the website in the top section includes examples of both types. Jennifer will add a link to the example maps in the chat now. This map should indicate the clinic location and distinguish the portion of the clinic service area that is within and outside the shortage area. It should, at a minimum, include all the counties within the shortage area that are the area to enable reviewers to clearly see what portion of the service area you will be covering as part of this proposal. A second map may be required, but only if you're applying to serve a type 1 shortage area. If this is the case, you must also demonstrate that the area you are intending to serve is considered rural, as not all type 1 shortage areas are in rural areas. You can do this by using the USDA property eligibility map. Enter the clinic address, and the site will provide you with a map indicating whether or not this is an eligible area. If it is not an eligible area, you are not eligible to apply to address this type 1 shortage area. If it is an eligible area, we ask that you select the print option from this web view, save the map as a PDF, and include it in your application. Jennifer is going to include a link to the USDA property eligibility map in the chat now. Next slide, please. Okay, now let's discuss the EET project narrative. Again, there is a table in the VSGP NOFO, which includes key instructions for the EET project narratives, but I will emphasize a few important reminders here. Again, attachments must be in PDF format. Written text may be up to 12 pages. This should be 1.5 spaced with 1-inch margins and 12-point font. Tables may be single spaced and 11-point font, and you are allowed 3 additional pages beyond the 12 pages for figures and tables. These pages should also have 1-inch margins. Within the narrative, you should provide an introduction or background which describes the nature of the problem your proposal seeks to address, your objectives and approach for addressing this issue, a plan for evaluating your results, a management and collaboration plan, and a timeline for your actions you proposed within the 36-month award period. Please note that these items are strictly enforced for page limits and spacings, and applications not meeting these bare minimum requirements will be returned without review. Next slide, please. If your proposal includes a partnership or collaboration with an outside organization, you will include letters of commitment from these partners. These are required from each partnering organization and must be signed by the authorized representative of the partnering organization on official letterhead. Please follow the naming convention here and save these as PDFs to include with your application. These letters should indicate agreement with the goals of the project, agreement with the information included in the management and collaboration plan, and reflect the specific roles and responsibilities of the organization related to the entire proposal. As noted on this slide and in the VSGP NOFO, commitment letters are not required for RPE, and we ask RPE applicants not to submit them. All RPE proposed activities should be accomplished within the clinic's abilities. Next slide, please. Okay, so both RPE and EET applicants are required to submit a data management plan. Data management plans are required for all NIFA applications, and these should again be saved as a PDF when submitting your application. We've provided a website for additional information on what should be included here. The data management plan should include detailed descriptions of what the expected types of data that might be collected. For RPE applicants, think about what data you might be collecting to indicate your progress in addressing the shortage area. So potentially numbers of clients, general client locations to demonstrate the breadth of coverage or expanded coverage in the shortage area, and services provided. If you were able to increase the services you were able to provide based on receiving this grant, that will be the type of data you'll include in the data management plan. And the plan should also indicate what format this data will be collected in, how it will be stored and preserved, information on data sharing, protection, and public access, and indicate roles and responsibilities for those involved in the proposal related to collecting, storing, and maintaining and protecting the data. Again, there's a good example on the link provided on this slide. Next slide, please. Okay, so both RPE and EET applicants are required to submit a biographical sketch for each project director and co-project director in PDF format. This can be up to 2 pages, 1.5 spaced, 1-inch margins, and 12-point font. You may include additional pages for a list of publications if needed. The bio sketch should summarize the education and training, research and/or professional experience, collaborations and professional affiliations, and any publications or synergetic activities that demonstrate your ability to carry out the proposed work. Some people choose to use the 2 pages as a resume type format. Others choose to use a narrative approach to their bio sketch. Your approach is entirely up to you, but as a reminder, please include this as a PDF with your application. Next slide, please. Okay, let's discuss the budget justification. So both RPE and EET applicants are also required to submit a budget justification. This can be up to 5 pages, 1.5 spaced, 1-inch margins, 12-point font. Some choose to use pictures of itemized expenses, and that's perfectly acceptable. The budget justification is your opportunity to justify the need for each expense, which should include a brief description of all itemized expenses and how they will be utilized, along with an estimated or exact cost of each itemized expense. For example, an RPE applicant may request a truck with a Bowie vet box. Each of these items would be separate in your budget justification. You would provide the estimated cost or exact cost, and you can reference your source for that cost. Then you would describe each itemized expense and how it will help you better serve the veterinary shortage area you're applying to serve. You may focus your description on the must-serve species, the must-serve counties, and the listed veterinary activities and services. Each expense typically includes 3 to 6 sentences of a description. Next slide, please. Okay, so we're going to discuss resubmitted applications. If you are resubmitting an RPE or EET application that was submitted previously and received a panel summary, but you did not get an award, this is the only case for you, right? This is not someone who has received an award and would like to expand on the services, and you're submitting a new grant at that point. So this is only the definition of resubmitted applications. You're allowed to include a 1-page response to previous review that must be saved as a PDF. The same spacing, margins, and font sizes restrictions apply to this document. You will use this 1 page to respond to the weaknesses that were identified in the panel summary from your previous submission. In general, it is recommended that you indicate how you modified your current proposal to address these weaknesses. When we see a response to a previous review included with an application, we will provide the panelists with the original reviews of your initial application, and they will take those into consideration as they review your proposal with this document that you submit. Next slide, please. All right, application submission. When submitting your application, please note that NIFA only accepts electronic submissions of applications through grants.gov. You can find additional information on this process in the NIFA Grants Application Guide. Our systems will not accept a document in formats other than PDF. So please make sure anything you upload to grants.gov is already in PDF format, and we recommend you do not use third-party PDF builders. While grants.gov may allow you to upload other document formats, such as Word documents, they will not be recognized by our systems, and you will end up with an incomplete application that will be returned without review. We hate turning away applications for this reason, so please, please, please ensure that all of your application materials are in PDF format. Next slide. All right, once you submit your application and we have reviewed it to ensure it is complete and meets the administrative requirements, it moves into the evaluation phase. Michelle will provide more details on the evaluation process in the next few slides.
Thanks, Danielle. Jennifer, can we go back to that last slide, please? Thank you. So every complete proposal is assigned to peer reviewers with relevant expertise. Each reviewer evaluates the strengths and weaknesses of their assigned proposals and provides an individual review. The individual reviews frequently serve as the basis for panel discussion with other reviewers and panel. And when this occurs, a summary review is produced that represents the consensus of the peer review panel. In VSGP, the panel includes practicing veterinarians, state animal health officials, veterinarians and others, and academia working on related topics. So keep your audience in mind when you're preparing your narrative and the rest of your proposal. Next slide. So the Veterinary Services Grant Program Notice of Funding Opportunity lists the evaluation criteria which peer reviewers consider when evaluating proposals. For RPE proposals, how well your expertise and experience is suited to addressing the shortage area is weighted at 30%, and the technical merit of your proposal, or how clearly you've outlined what you are proposing to accomplish and your plan for accomplishing it, is weighted at 70%. Please keep in mind, if it is important to demonstrating your ability to successfully complete what you propose, you need to make sure you address it in your proposal. Reviewers cannot evaluate information that you do not include in your proposal. So links to outside sources are not going to be followed. They're not going to look up your veterinary clinic to see who you have on staff. Make sure you include it all in your proposal. Next slide. For EET, how well your team's experience and expertise and any institutional resources addresses the team's ability to conduct the proposed work is weighted at 10%. The technical merit of the proposal, which includes how clearly you lay out your objectives, activities, and proposed outcomes, and the reasonableness of your budget, is weighted at 50%. And the reviewer's assessment of your probability of success based on what you included in your proposal is weighted at 20%. Again, like I said on the last slide, for EET as well, if it's important to demonstrating your ability to successfully complete your work, please make sure you address it in your proposals. Reviewers cannot evaluate information that you do not include in your proposal. Next slide. So this slide includes a general estimation of the timeline for competitive programs. Generally, application deadlines occur within 1 to 3 months from the time of NOFO publication. We generally allow 3 to 5 months for applications to undergo peer review because we want to make sure that reviewers have plenty of time to conduct a thorough and fair evaluation of your proposals. And the last 1 to 2 months are used to finalize awards. So on average, a competitive program takes about 4 to 6 months from the application due date to an award being made. We will keep you updated as much as possible and appreciate your patience throughout this process. For the FY26 Notice of Funding Opportunity, we anticipate making award announcements sometime towards the end of this fiscal year. And we do have a few slides with additional information that might assist you as you move forward with your application. And I'm going to pass it back to Danielle to provide you that additional information.
Thank you, Michelle. If you're seeking inspiration or looking for examples of successful proposals, these links will take you to a list of previously funded RPE and EET awards, which include information on objectives as well as annual reports and accomplishments. Before we take questions at the end of this webinar, I will give you a quick overview of how to review this information on our website. Next slide, please. This page contains several useful resources you might want to consult when preparing your proposal and may answer many of the questions that arise as you're preparing. I especially want to encourage you to review the NIFA Grant Application Guide, which walks you through the application process step by step and is essentially synced with what you'll go through in grants.gov. None of these resources are a replacement for the VSGP Notice of Funding opportunity. So if the VSGP Notice of Funding opportunity directs you in a different way, for at least formatting, say, of your narrative, or other attachments, please follow the VSGP NOFO. Next slide, please. If you're interested in other NIFA events or other funding opportunities, you can use the link provided on this slide to keep up to date on what is going on at NIFA and future webinars. Next slide, please. If you have very individual questions that you do not want to ask as part of this webinar, or think of a question after the webinar ends, you can reach out to us at vsgp@usda.gov. This is a shared inbox that our entire team monitors, which is our preference for you using this direct email instead of some of our personal emails. Next slide, please. This slide is a USDA non-discrimination statement, which states, in accordance with federal civil rights law and the U.S. Department of Agriculture, USDA civil rights regulations and policies, the USDA, its agencies, offices, and employees, and institutions participating in or administering USDA programs are prohibited from discriminating based on race, color, national origin, religion, sex, disability, age, marital status, family or parental status, income derived from a public assistance program, political beliefs, or reprisal or retaliation for prior civil rights activities, and any program or activity conducted or funded by USDA. Remedies and complaint filing deadlines vary by program or incident. The rest of the slide contains contact information for individuals with disabilities to request reasonable accommodation, that language access services will be provided to limited English proficient individuals upon request, and that anyone wishing to file a complaint can utilize the phone number, fax number, or postal mailing address listed on this slide. We will now open the floor for questions. There are several ways that you can ask questions, and I see that the chat and the Q&A have already been very active. First, you can raise your emoji hand and we will invite you to come off mute to ask your question live. You may also use the Q&A function to ask your question, which does allow you to submit your questions anonymously. We've learned recently that some external to USDA users have issues with the Q&A function in the past. If this is your case, you can either ask your question live or use the chat. Before we get started with questions, I wanted to quickly show you what the previously funded projects links looks like. So give me just a second here while I share my screen. Okay. So anyone who registered for this webinar will be sending you an email with the recording and a copy of the slides. You can access the links to previously funded projects this way. It's also available on our webpage right here. So I'm going to give you a quick example. I'll click on this link, which is the same that was in the slides and what was put in the chat. And this is going to list all 77 EET projects that have been funded between 2016 and 2025. As you scroll down, you'll get the project title, the recipient organization. You'll see the methods of their proposed activities, a non-technical summary, and their objectives. And all of this information is here. What you're seeing will be displaying the most recent awards first. So if you scroll way down and go to older pages, you'll likely see this one was funded in 2022. More updated information. Okay, this isn't exactly what was submitted in their application. This is submitted afterwards through our report system. So that was an example of EET. RPE is going to be the same information. So if you're curious, go take a look. That information is there. All of these applicants were successful in applying to VSGP. Okay, and with that, I think we're ready to open the floor for questions. So if you'd like to ask your question live, you can raise your emoji hand. If we don't see anyone raising their hands, we'll likely jump into a lot of the questions that have been posted in the Q&A in the chat, and Jennifer will monitor them. Thank you.
While we're waiting for people to overcome their shyness, if they're going to raise their hands, there were quite a few questions in the chat while Danielle was speaking earlier about if I have somebody who was a VMLRP recipient, they are not currently an active recipient, but they're applying to renew, can I apply with that shortage? The answer is no. You have to have an active VMLRP recipient, so their award has to be active. They have to have an active agreement with NIFA. If there is an eligible shortage area that your clinic services, you are still eligible to apply for the RPE program. You would just have to apply to that new shortage area. And your VMLRP recipient can still apply to renew their award on the VMLRP side as well. The other question was, oh, I forgot what it was, so I'm going to have to go back and look at the chat.
Can I add to that, Michelle?
Sure, please.
So in that very scenario, so somebody has finished their VMLRP award and is going to reapply this year. If there's not an active shortage area that you can apply to, and the VMLRP person at your clinic receives a renewed award this year, then the following year for VSGP, you can use that shortage area, but not this year. This is a gap year that would not qualify you for doing that. But if they are awarded for a renewal, then you can use that shortage area next year to apply to VSGP.
One of the first questions in here is, how are we defining rural? So there was a link that we put in the chat. It's based on a USDA rural development map software. So you need to, and that link is also included in the notice of funding opportunity. You go to that page, you put the address of your clinic in, it will generate a map, and it will show very clearly whether it's in a rural or a not rural area. You need to print out that map and submit it with your application. All right, Dr. Cannon. Wait a minute. I think we have to let you off mute. No, we don't. No, you have to unmute.
I did.
Okay. You should be able to unmute now. All right. Well, while we're waiting,
you should be able to unmute now.
We can't hear you. You need to actually actively unmute your mic now. And now I still can't hear you. Sometimes you have to actually select the correct mic from the mic button.
No?
Yep, yes, we can hear you now.
You can?
Great.
Yes.
Yes.
No. Oops. Now?
Yes, we can hear you.
Okay. My question is, it's a 3-year is the timeline for the VSGP EET, but the budget is sort of limited. So if a proposal is, say, fund support submitted for 2 years of funding, will it still be eligible, or you have to have a full 3-year timeline?
You should plan on having a 3-year timeline. So if your funds are, what do you plan on using the funds for? For supporting an intern or a resident? There should be other activities besides just funding their salary for 2 years. The proposal itself and in its entirety needs to be 36 months.
36 months, okay. The second question I have is, what is the success rate? You have 77 projects that have been funded over the timeline that you mentioned, but like, what is the success rate on average? Is that known for the EET funding?
You have those numbers handy, Danielle?
I could find them quickly. Let me dig them up and I'll get back to you. I'll let you know what the past in 2024, what the success rate was.
Thank you.
All right. Any other questions while you're up? Okay. Dr. Thiago Martins, I've activated your microphone, so you should be able to unmute and ask your questions.
Hello, can you hear me?
Yes, we can.
So my question is, what is the proportion of the funds that I can use to buy equipment? And the second question is, can I use the funds to purchase animals to be used in the trainings?
As long as it falls within the allowable costs for traditional grants, the answer to that is yes. I don't think there's any restriction on the amount of funding that you can use for equipment or animals. Just make sure that you include it in your budget justification, what you're expending funds on and why. And Danielle, I see that you have something to add to that, so I'm going to let you chime in.
Yes, this sounds like it is for an EET application. And just as a reminder, the EET applications are focused on education and training. And the panel tends to be pretty critical of organizations or institutions that are requesting equipment that should be provided by the institution, right? So, just keep that in mind. If your institution is accredited, which it needs to be to, be applying, if they're not providing you with basic equipment to, be properly educating your students, that tends to be looked upon as slightly critical. So any equipment that EET applicants are requesting should be specifically focused on whatever training activities. For example, if you're requesting a truck with a Bowie vet box, that is incredibly appropriate for the RPE applicants, slightly less appropriate for an EET application, if that makes sense.
Yes. I'm asking because they recently built a new facility for training vet students. We have the facility and everything, but and we can train 11 students at the same time. However, we don't have microscopes or this kind of equipment or nitrogen tank. I work with reproduction. That's why I'm asking. So for a new facility, even though we would be considered inappropriate in this case.
So I think that's something you're going to really have to justify in your narrative. I think that you have to consider your audience. And we have veterinarians as well as veterinarians from academia and other institutions. And I think that from what Daniela said, and she's been on VSGP panel more than I have because I've just picked up this program recently, it sounds like the panels really consider what veterinary schools should already have in terms of educating their students. So if your school does not have that for some reason, you're going to have to really justify why and why this is important.
Thank you. Thank you very much. Appreciate it.
All right, Dr. Nessa Stitka. I am enabling your microphone.
Okay, can you hear me?
Yes.
Okay, so I had a question for the RPE. Can you write that budget so that it could all be spent like right away the first year, and you're going to use everything for 3 years, or do you need to like spread out the spending throughout the 36-month period?
You do not need to spread out the spending throughout the 36-month period. Please be aware that you are required, both EET and RPE recipients, to submit an annual report. So you'll need to build into your narrative how you're gonna use the equipment that you're purchasing in that first year to continue to build your practice in that second and third year. And you'll need to report on those accomplishments in your annual reports. And some people get the funding, spend the funding, report the first year, and then don't see the email reminders the second and third year. If you don't submit those reports in a timely manner, it can impede your ability to get future funding from the federal government.
Okay, thank you.
Sure.
Yeah, I would just add that it's very common for RPE awards to spend most of the money within the first few months, but then you're required to continue to service that shortage area and provide updates on the data and what you're doing for the 3 years.
And there is a question that I've seen a couple times, so I want to make sure I address it because we weren't able to get Dr. Cannon off mute. In terms of, I did say we are working to rectify getting veterinarians mentioned in that section C1 G. However, it's not there yet. So right now, the priority list as it is as it is. If there is a modification to the notice of funding opportunity, we will send out an email to our stakeholder list. And I believe, Danielle, we can email everyone that's attended this webinar as well, correct?
That's right.
So you will get written notification from us if there is a change to the notice of funding opportunity. Dr. Mitchell, I'm going to enable your mic. So you should be able to come off mute and ask your question. All right, while we're waiting for Dr. Mitchell, what else do we have that we need to address, Danielle, in the chat?
Yeah, I have a question. Oh,
no, go ahead.
Doctor. This one is from Jennifer Martin in the Q&A. What is the definition of food animal for the scope of this project? Would this include rabbits, chickens, or horses? And first, I just want to mention that if this is in reference to an RPE grant, a Rural Practice Enhancement grant, that you'll be applying to a specific veterinary shortage situation area. Okay, and that will detail the must-serve species, and that should be your focus. So if it may be dairy, it may be beef, it may be poultry, it may be small ruminants. Okay, but that is detailed in every specific shortage area. And then we also include all agricultural animals. And that's where you may justify rabbits, chickens, or equine. Equine should be focused on working animals and not show animals or companion animals in that way. Michelle, do you want to add anything there?
No, I think you covered it all, Danielle. Thank you. There is a question, and Danielle, I'm going to defer to you on this one. I'm pretty sure it's Dr. Mitchell's question because they put it in the chat as well. Can CVTEA accredited veterinary technician schools apply for the EET without having a partnership with a vet school?
Yes, we have. If you check out the previously funded EET proposals, there has been one successful veterinary technician program. As long as you're accredited and the focus of your proposal is on food and animal training of veterinary technician students, you're eligible to apply.
And Dr. Mitchell, it looks like you're unmuted, but we cannot hear you. So hopefully we answered your question. All right. There is a question from VSGP. Does VSGP RPE provide extra funding for taxes? Or do we just rely on the depreciation of the equipment to offset taxes? This is from Ben. So VSGP, remember, this is not an individual award. This is an award to the business, and we do not offer tax advice. We suggest that you work with your accountant on how to handle the taxes related to VSGP RPE. There is not additional funding as there is with VMLRP to offset the taxes on the individual basis. And the other thing that's probably important to note when discussing with your accountant, we do not provide 1099s.
I see another question early on in the chat from Paul Martin. The question is, our clinic has multiple veterinarians and the shortage area is designated as type 2. Does this mean the clinic as a whole needs to service ag animals for 12 hours a week? Or does each veterinarian individually need to meet that requirement? So the answer to that is neither. That percent FTE is specific to VMLRP. The expectation is that VSGP RPE awards will be able to fully service the needs of that shortage area, which is likely more than the 12-hour commitment listed for VMLRP.
And that could be done through utilizing one clinician in your clinic or multiple clinicians.
Yes, the whole clinic, not individually.
I see a question from Olivia Boyd. Can the clinic be located out of the counties in the shortage area, but the location borders the counties to be served? Yes, your clinic does not have to be located within the shortage to apply. You do have to include in your narrative how you are going to address that shortage. And remember, you need to include a map of your clinic and how it's associated to the shortage area. So the reviewers will kind of understand where you're located, and you can use that when you're discussing that in your narrative.
Okay, and then in the chat, we have a few questions submitted from Karen Baker and Joaquin Kakaris, I think is how you pronounce that, for clarification on EET limitations. Am I correct that if a department was awarded 2 years ago, the same department cannot be awarded another grant until the first grant has ended? The following question is similar. For EET, if there was an active award in Department X submitted on a previous year, can someone else from the same Department X submit another proposal on a different year? Yes. So if there is an active award from your department and institution, you can still submit. If you're a different project director, if you're the project director on the active award, you must wait until your award has ended. But this does not restrict people from that department from applying each year, as long as they're different project directors and different projects in its entirety. And multiple applications can be submitted for each department every year, but only one will be offered an award. Michelle, would you like to add?
No, I think you covered it all, Danielle. There is a question in the chat about what is the earliest that a formerly funded Rural Practice Enhancement applicant can apply for a new RPE award. So this is a change from last year's request for applications from 2 years ago, where there was a 5-year period after the end of your award. Now your award has to be ended. So if you have a 3-year award that ends in 2026, as long as it's ended before the application deadline, you can apply. If your award is still active and goes through July, you would not be able to apply until next year. So your award has to be ended, and that if you got a 3-year award and got a no-cost extension, your award has to be fully ended, and that includes any no-cost extension periods. So if you're still have an active award with NIFA from the RPE side, you are not eligible to apply until your award ends, and then we post another notice of funding opportunity.
I have a couple in the Q&A.
Okay, shoot, Jennifer.
From Shannon Casperson, are biosketches also required for co-investigators, not just the PI or PD or any other PIPDs?
Yes, oh, go ahead, Danielle.
So just for the project director and co-project directors, if you're collaborating with someone outside of your institution, then you just need that letter of commitment. You don't need a biosketch for them. So if they're being listed as a co-project director, yes, you need to provide that.
And
all right, I have another one from Cody Blumenshire. There were various levels of registration for the unique entity ID from SAN.gov. Do you have any insight on which level or registration we need to obtain? I was able to obtain a number, but it only took me 4 days, not the 4 to 6 weeks.
The process may have become faster, right? They switched these numbers about 3 years ago, and 3 years ago it was taking a very, very long time. So it sounds like this is up to date. As long as you have an active UEI number, you'll be able to submit your application through grants.gov and then receive federal funding. Different levels do not apply to VSGP.
All right, and I think we might have answered a version of this already, but this is from Leah Dorman. There, for RPE, the clinic addresses has to be rural, but but what if the clinic isn't in the shortage area but serves the shortage area?
that's a good question. Danielle, have you ever encountered this before?
Sorry, can you say that again?
Yeah, it
says, what if for the RPE address for the clinic, it says, what if the clinic isn't in the shortage area but serves the shortage area?
If it's not in if the clinic is, so this would be for a type 1, right? If you're applying for a shortage area that's a type 1, right, that's the only time that you need to clarify that your area is designated as rural. And if your clinic location is not rural, but the service area is, I would include that map and add a description in your narrative of such. We haven't seen this before. A lot of type 1s happen to also be rural, but please reach out to us at vsgp@usda.gov if you're having issues figuring this out, and we'll look into it in more detail.
Okay. And I believe the answer to Karen's question is in the chat. And let me refresh my.
While you're refreshing, we did have a question in the chat about will a recording of the webinar be made available for review? Yes, if you registered for this webinar, you'll get an email from us when that is available. I'm also putting the link for the NOFO page, which includes a link to the technical assistance webinar page in the chat. So you can access that, and that will load the slides and the recording to that page.
All right, another one from Dr. Martins. Can I use EET funds to subside training for producers, for example, in bovine artificial insemination?
So EET training should be focused on training veterinarians, not producers, right? Or veterinary students, veterinary technicians students, high school students in 11th and 12th grade. This is not training for producers. There may be other NIFA funded grants, such as the AFRI Education and Workforce Development Grant, that may be a fit if you want to focus on training producers. But VSGP would not be the grant for that.
And I have a couple more questions in the chat related to the VMLRP, VSGP conjoination. So when applying for an RPE, can a current VMLRP recipient apply even if the area isn't currently listed as a shortage? Yes. the clinic that employs the current VMLRP recipient can apply for an RPE using the current VMLRP awardee shortage area. If they are awarded, they must agree to continue employing that individual for another 3 years. So for the duration of the RPE award, in addition to their VMLRP award. And then there's another one. Our business employs a current VMLRP awardee that is in year 2 of 3. Does our project narrative need to be written as a 2-year plan, or is the grant always on a 3-year plan? Yes, the grant is always on a 3-year plan. So if you have a VMLRP awardee in year 2 of 3, you still have to provide for 3 years in your RPE. Jennifer, do we have anything else in the Q&A?
Not that I'm seeing. I've been putting a thumbs up on ones we've answered. Same for the chat. I don't see anything new there that we haven't addressed because folks are putting the same question in both places.
I have the success rates right from 2024. So thank you for reminding me, Ben. I had that pulled up and I apologize. I forgot about you. So for EET, the success rate was 25%. And for RPE, it was 36% success rate.
Okay. Is U.S. citizenship a requirement to hire interns, residents, etc. in EET? I'm not aware of that restriction at this time. However, be aware that we've had a lot of new executive orders, and all awards that NIFA makes need to be compliant with all new executive orders. So that may change. As far as I'm aware, and Danielle, I'm going to look to you to see if you have any other knowledge. That's not a requirement right now.
That's not, I'm same with you, not that I'm aware of, but some of the new executive orders may make that otherwise.
All right. Looks like we've addressed everything in the chat and Q&A. Last call for questions. Right. Well, thank you all for your participation today. We appreciate your engagement and your willingness to make time out of your busy day to attend and get your questions answered. If you have any more questions, please do not hesitate to email us at vsgp@usda.gov, and we will get to your questions as soon as we can. Thank you all again.